Hello and welcome to Pune Times Mirror. Today, we are going to have a conversation with the celebrity psychiatrist and sexpert Dr. Rohan Jahagirdar. Hello, sir. How are you doing today?
Hello, I'm doing well. Thank you for having me. Namaskar.
What are the five most common types of anxiety disorders like OCD, PTSD, etc.? So, can you please elaborate a little on each of them?
Sure. See, anxiety essentially has to have is a persistent form of restlessness, fear that comes inside you. What is the difference between anxiety and fear? So let's say anxiety is, if you have a snake here, that is fear of the snake. You are scared of the snake. That is not anxiety of the snake. So for something to define as anxiety, first let's understand what is anxiety. Anxiety is internal, inside you. It is vague. If I ask you what are you scared of, you will not be able to say, I don't know. It's just something I'm scared. And it will always produce a conflict. So am I looking good? Am I speaking well? Is somebody upset with me? Is the boss going to scold me? You are always in a conflict. So anxiety is internal, it is vague and always conflict producing.
Okay.
That's the basis of anxiety. Anxiety disorder can come at any age. The types that you were discussing, out of the spectrum of the anxiety, the totality, there are many types of anxiety disorder. The commonest we encounter is a panic disorder, where there is intense anxiety in a small, very, very short period of time.
Okay.
So it can be mimicking, and people can think that it is almost like a heart attack. So you feel breathless, you find you're having palpitations, you suddenly start choking. There is intense fear experienced in a very short period of time. That is the panic disorder, also referred to as panic attacks. The second is social anxiety disorder. So I am okay, comfortable alone, but if I have to deal with people, I get very uncomfortable. That is the social anxiety. Specific phobias could be of stage fear, of a snake, of a building as in claustrophobia, entering a lift, of going and people mixing with people or in a crowded place, that is agoraphobia. So specific phobias can be different, like I said, claustrophobia, agoraphobia, these are specific phobias. One other thing is OCD you mentioned. Nowadays OCD is qualified as a separate illness. Although it is rooted into the anxiety, the illness is a separate illness. Obsession, by definition, is a thought, image, or idea which is senseless, which is repetitive, which originates from yourself, and which produces anxiety. A thought, image, or idea which is senseless, repetitive, originating from yourself, and produces anxiety. So, for example, if there's a pen here which is lying straight, I want to keep it, horizontal. Continuously, even if I'm talking to you, I'm more worried it has to be like this, it has to be like this. That is an obsession. Acting on those obsessions is called as compulsion. That is called as OCD. Common forms are repetitive of hand washing, fear of contamination, especially after COVID, issues like fear of germs. So people who are suffering with OCD might take hours and hours to take a bath, may not get out of the house. So typically anxiety consists of, like I said, the panic disorder, social anxiety disorder, specific phobias, OCD, and one other thing is post-traumatic stress disorder. So once you have experienced trauma to a level, post-traumatic stress disorder is not, for example, like my girlfriend has not called me, is not post-traumatic stress disorder. The trauma has to be of that level. Seen in prisoners of war, seen in heinous crimes, sudden very severe experience of extreme trauma leads to post-traumatic stress disorder, and people relive those things. That is called as flashbacks. So these are the different types of anxiety disorders.
Absolutely. So now, next I would like to ask you, if anxiety disorders are not identified on time, then what could be the adverse effects or the impacts of it on one's mental health?
See, anxiety significantly limits your ability to achieve things. So for example, I might be the most bright student in the class. I might know all the answers, but just because of my fear of expression or public speaking, I will not answer. And that's how I will grow all my life. Thereby limiting my ability, that is what I'll become. My decisions in life will be based on the fact that I'll be able to communicate or not. Or this is one example of public speaking. But there could be many such things. Even taking a decision, any small decision, if I am always going to be anxious, it is going to direct what decisions I take. those decisions are generally going to influence my life. So if it is not treated on time, it can affect your all aspects of your life. For example, your career, your relationship, because you're going to be anxious, you're not going to implement what you think. You are always going to be, I will not say bullied, but dominated by your partner because you are not expressing. You are going to raise your children tomorrow thinking that the way you are. So if I raise my children saying that outside this room there is a lot of, you should not go out because I'm scared, they are going to be raised the same way, thinking that they should not go out because it's scary outside. So answering the fact that if anxiety is not answered, every aspect of your life can be affected.
Okay, that's great. So now, sir, I would like to ask you in terms of anxiety seen in children or youth in today's time. So, what advice or simple measures would you like to suggest regarding this?
First is identify your stress, so identify what is causing it.
Okay.
Second is to accept that you suffer with this disorder. So, for example, if I am sitting in a class and I am unable to pay attention because my heart is palpitating or because I am extremely scared, that is something I should accept first. So what happens is classically we see that patients develop over a period of time lot of different kind of symptoms, headache, backache, chest pain, lower back pain. They will go to the doctor for those reasons, or IBS as we call it, irritable bowel syndrome. But origin of all of that could be anxiety. So first is to identify, second is to accept, and third will be taking professional help for it. And it is definitely going to be helpful for them.